Hi everyone, welcome to Safer Sex for Queer and Trans Bodies. My name is Sarah, my pronouns are she, her, and hers.
And I'm Simone, my pronouns are also she, her, and hers.
We're from the Stages of Life Empowerment Program from Native American Community Services, and again, welcome. A little bit about who we are. So we're a teen pregnancy prevention program. We provide free health and wellness workshops. We provide free sexual health clinic tours, and we also have a free condom availability program, and we're located in Buffalo, Niagara Falls, and Montclair. So our objectives for today are to provide an overview of STI transmission, testing, treatment, and prevention, to explore why LGBTQ young people are disproportionately impacted by STIs, to identify safer sex strategies for LGBTQ young people, and finally, to demonstrate effective barrier use. To start us off, we'll go over what STD and STI stand for. STD stands for sexually transmitted disease, and STI stands for sexually transmitted infection. A lot of the times people use these interchangeably. We'll try to use STI during this webinar, but just know that anytime you hear any of these terms, we're referring to the same types of things.
When we do this workshop face-to-face, we ask our participants, what are some STIs that you can think of? Now we have them up here and we'll go through them by category. So in the purple text, you'll see parasitic STIs. These are caused by a parasite or a little bug. These include infections such as trichomoniasis, crabs, and scabies. Then you'll see bacterial STIs in red. These are caused by a bacteria. These include things like chlamydia, gonorrhea, and syphilis. And lastly, you'll see the viral STIs in green. These are caused by a virus, and they include things such as HIV, which stands for human immunodeficiency virus, HPV, which stands for human papillomavirus, herpes, hepatitis C, and hepatitis C. A thing to note here is that both parasitic and bacterial infections can be cured. When it comes to bacterial infections, a person may get tested and then be able to get treatment. They would take something like an antibiotic and then they would be cured of the STI. When somebody has a virus, it's inside of their body for their entire life. However, there are medications that a person can take to treat that virus and to keep that viral load low. For example, when it comes to HIV, a person can take antiretroviral medication and their viral load may become so low that they actually become undetectable. And so when a person's viral load is undetectable, that means they're untransmittable. So you may have heard the campaign U equals U, which stands for undetectable equals untransmittable. And so that message is just basically trying to tell folks that, hey, if you get tested and you get on treatment and you stay on treatment, your viral load will be so low that you won't be able to pass it on to anybody else. So those are just some important things to know about the differences between bacterial and viral.
Next, we'll discuss what behaviors can lead to an STI transmission. So the main way that STIs are passed from person to person is through unprotected sex with an infected partner. And to expand on that, this includes vaginal, anal, and oral sex. Another way is through intimate skin-to-skin contact, and then also sharing needles of any kind. So this can include sharing needles for drug or substance use, for tattoos, piercings, anything of that nature. And then the last thing that we want to mention is birthing parent to child, also known as mother to child. Although this isn't necessarily a behavior that folks engage in regularly, it is another way that an STI can be passed from person to person. To get more in depth on how STIs are passed from person to person, we're going to talk about bodily fluids. So the 5 main bodily fluids that folks should be aware of are blood, semen, vaginal secretions, rectal fluids, and breast milk. So as you can see, HIV, hepatitis B, chlamydia, gonorrhea, syphilis, and trichomoniasis can all be spread through bodily fluids, those 5 that I listed before. And then hepatitis C can be transmitted through blood contact only. Also, HPV, herpes, crabs, and scabies can all be passed from person to person through intimate skin-to-skin contact. And again, at the bottom of the slide, you'll see a key that outlines viral, bacterial, and parasitic STIs. So what are some symptoms of an STI? Well, the first thing I want to say is that the most common symptom is no symptoms at all. However, if someone is experiencing symptoms, they might feel burning when urinating or peeing. They might have sores, blisters, warts, or pimples near the genitals or mouth. They may experience an unusual discharge from the penis or vagina, or rash or itchiness in the genital area. They might experience frequent urination, and lastly, abdominal pain or belly pain. But again, the most common symptom is no symptoms at all, which is why it's really important to get tested and know your status. All right, so next we're going to talk about who can get an STI. And the quick answer is anyone and everyone. Essentially, every person is vulnerable to STIs, but we do want to take a moment to recognize that young people are disproportionately impacted. As you can see in the pie charts, young people ages 15 to 24 make up 1/4 of the sexually active population. However, they make up half of all new STI infections. Furthermore, we want to recognize that LGBTQ young people are 2 to 3 times more likely to be involved in an unintended pregnancy. They're also disproportionately impacted by HIV and other STIs. Also, LGBTQ folks experience higher rates of intimate partner violence and sexual abuse. There are a lot of different reasons why these things happen. But this illustration of this homophobia umbrella does a really nice job at showing all of the systems that are at play. So a lot of the times, LGBTQ young people might not experience the most inclusive sex education experience. They may also have a lack of support from school, from family, or friends. And if they're not having that support at home, that could ultimately lead to homelessness, which could further lead to survival sex if someone is trying to find a roof over their head or somewhere to stay. You know, they might exchange sex for those goods. So that's what survival sex is. And then some other things that might be at play include violence, harassment, or discrimination, which might then lead to someone using substances more often, or it could also explain dating violence and rape. So there are a lot of different things, again, at play here, and we just want to take this moment to recognize all of these. Next thing I'm going to do is turn it over to Simone.
All right, so next we're going to talk about how we can reduce our risk of STIs. So the surest way to protect yourself against STIs would be abstinence. That's abstaining from or not having any kind of sex, as well as not sharing needles for any reason. If people decide to engage in these behaviors, you can use a barrier during sex to help protect yourself. We'll talk about the barrier methods in a couple slides, and I will do some demonstrations for you as well. And then if you are using needles for any reason, not sharing them. So if you're getting a tattoo, making sure that they're using a brand new needle every time. Same thing with getting a piercing, making sure they're using a brand new needle anytime you're using the needle for any reason. Also avoiding alcohol and other substances that can impair your judgment. And then the Gardasil vaccine is a vaccine that prevents the most common strains of HPV or genital warts. And this is a really great option for people because HPV, if left untreated, can lead to cervical cancer as well as a couple other kinds of cancers. So this is a cancer preventing vaccine. Another option for people is PEP and PrEP. So these are both medications that can help prevent HIV. So PrEP, if someone is engaging in some behaviors that could potentially lead to an HIV transmission, they can get on PrEP, which stands for pre-exposure prophylaxis, and it's a pill that you take every day to help HIV from taking hold in the body. It puts a bubble around the white blood cells that makes it so HIV can attack those white blood cells. And then PEP stands for post-exposure prophylaxis. So if someone has engaged in a behavior that could potentially lead to an HIV transmission, they can get on PEP after that potential exposure. So if someone goes and gets a tattoo and they don't know if that person used a brand new needle, they can go the next day to the hospital or their healthcare provider or Planned Parenthood and talk about getting on PEP. So again, what that will do is put those bubbles around the white blood cells and prevent HIV from taking hold in the body. You take these pills for about 30 days after that exposure. And then the last thing we want to talk about is getting tested. Knowing your status is one of the best ways that you can protect yourself. All right, so now we're going to discuss barrier use. So there are lots of different types of barriers. We'll talk about some more as we go, but there are both latex and latex-free barriers. They also have all different kinds of condoms. They have glow in the dark, they have flavored, they have ribbed, they have fire and ice, pretty much anything that you can imagine. They also have different brands of condoms. They have Lifestyle and Trojan. They have one brand. Internal condoms are called FC2 is the brand that people most commonly know about. So there are, again, lots of different brands. And you can get barriers at a variety of different places. Some of the ones that are a little bit harder to find, we'll talk about more in a couple slides. But external condoms you can access pretty much anywhere. They have them at the corner store. People have them at their barber shops. They have them at a school nurse's office. You can get them for free at healthcare providers. So there are tons and tons of different places that you can access external condoms. All right, so next we're going to talk about what a condom is, and then I'll do our first demonstration. So a condom is a thin latex or rubber sheath that slips snugly over an erect penis or sex toy, such as a strap-on. The purpose is to keep semen from entering the vagina, mouth, and or anus during sex, and it protects the penis from bodily fluids. Latex or polyurethane or polyisoprene condoms help prevent pregnancy, HIV, and other STIs. So now you can see me up in the corner of this screen, and I will demonstrate the steps for effective external condom use. Before we get into this, I do want to mention our little bubble that we have in the corner. It's talking about consent. It's really important to both acquire and give enthusiastic consent before and during any kind of sexual activity. You want to check in with your partner and make sure that they're enjoying what's going on and that both people are wanting to engage in the behavior that you're deciding to engage in. So now jumping into our demonstration, the first thing that you want to do is you want to acquire your condom. So like we said, there are lots of different places that you can access them. So you can get them at health centers, all different kinds of places. This one came from Native American Community Services, where Sarah and I work, and you can get them for free from us, again, like I mentioned before. So after you acquire your condom, you're going to want to check the expiration date. It's going to be right on the back. So once you've done that, you're going to check the package for holes. So you want to make sure that there's no holes in the condom. You should be able to push on it and feel that there's a little bit of air in there. So then you're going to carefully remove the condom from the package. You're going to push it over to the side and tear it right along the perforated line. You don't want to use teeth or scissors for this because there's the potential that you could tear the condom, which is going to make it not effective. So the next thing that you want to do is, if you'd like, you can dab lubricant on the outside of the condom for your partner, or if it's a person with a penis using the condom, you can dab lubricant on the inside of the condom as well, just to cause a little bit more pleasure. You can see here, this is a water-based lubricant. We'll talk a little bit more about that in a few slides as well, but you want to use a water-based lubricant with condoms. So next, you're going to squeeze the tip of the condom to leave room for ejaculation, and you'll place it right on the head of the penis. And then you roll the condom to the base of the penis or strap-on, like so. So you'll keep that in place while intercourse is happening, ejaculation or orgasm happens, and then you're going to hold onto the rim of condom, and here you'll turn away from your partner and withdraw the condom, or withdraw the penis or sex toy from the condom. Next, you're going to wrap it up in tissue and toss it in the trash. We're not going to throw this in the toilet and flush it, because that can definitely lead to a really uncomfortable conversation with a parent, roommate, plumber, somebody you definitely don't want to have that conversation with. So you'll always want to throw that in the garbage. If you're worried about somebody finding it, you can take it to the garbage outside, but do not flush that. All right, so next we're going to talk about internal condoms. So an internal condom is a polyurethane pouch with flexible rings on both ends, and this can fit inside of a vagina or an anus. Again, the purpose is to help prevent pregnancy and protect against STIs and HIV. But a fun fact about this one is that it can be inserted up to 8 hours before sexual activity. So if you're going out tonight and you know that you're gonna try to get busy or whatever it is you do, you can pop this in ahead of time, and it's good for up to 8 hours, which is a really cool kind of thing. Another thing that's cool about this is, I've mentioned before, it's a polyurethane pouch. So if somebody has a latex allergy and doesn't have a latex-free condom, this could potentially be a good option for them. So again, we want to mention, before any kind of sexual activity, make sure that we're both giving and acquiring consent. So next, we are going to acquire our condom. So internal condoms are a little bit harder to find. This is what they look like. They aren't often found at a drugstore or grocery store, but you can get them from a healthcare provider. You can also order them on Amazon, and you can even get a prescription for these from a doctor. So that's a cool fact about those. So you're going to want to check the expiration date again. On these, the expiration date is actually in the side pocket, so you can just open that up and check. And you're going to want to do the same thing, check and make sure that that air bubbles in here, that there's no holes or anything in there. And then you're going to carefully open the package the same way as the external condom. Push it to the side and tear, not with teeth or scissors. And then you'll remove the condom from the package. And so it looks like this. You can see it's got a ring on each end. So again, if desired, you can dab lubricant on the inside and or the outside of the condom. And so then our next step is we're going to squeeze this ring that's at the bottom. And then you'll just insert it right into the vagina using your fingers. And you can push it right up against the cervix. So you can see this will just stop right at the cervix, and it'll stay in place there. And then if you'd like to, you can then dab the lubricant on the inside of the condom. So you're going to keep this in place while sex is happening. You can insert a penis or sex toy at this point and hold the condom in place while inserting. And then once intercourse happens, you don't have to hold onto the condom anymore. Once body heat is happening, it'll make it stick to the vulva. And then once ejaculation or orgasm happens, you can remove the penis or sex toy, and then you'll twist and pull the condom from the vulva or anus. And another way you can see, so that was inside of a vulva, but you can see what it would look like inside of an anus as well. You can take the internal ring right out for that, actually, and place it right on the outside. So when it's on the outside, it'll act as a stopper, and you can see it'll look just like that in an anus. And you want that stopper there because the anus does not have a cervix the same way that a vagina does. So it doesn't necessarily stop, and you don't want this to slide into the anus and get stuck. So then again, once sex is done, you'll remove and toss it in the trash. Not in the toilet. One more time. Don't forget that part. Okay, so next we're going to talk about dental dams. So a dental dam is a thin piece of latex that will cover the vulva or anus during oral sex, and it keeps bodily fluids from being passed between people. Again, this helps prevent HIV as well as other STIs. So our steps for effective dental dam use are once again going to be acquire the dental dam. So like we talked about with the internal condom, these ones are a little bit harder to find, but you can access them in those same places. You can order them on Amazon, you can get them at a health clinic, or you can get them for free from us at NAPS. So make sure you acquire your dental dam. And this one is going to have the expiration date right on the back at the bottom. So you're going to check the package one more time, make sure there's no holes, and then carefully open the package and pull out the dental dam. I'm going through the steps here today, but a lot of times there's going to be a piece of paper that comes in the packages that will have the steps on the inside that explain how to use it as well. So you're going to just open this up. You can see what it looks like. Sorry, I have lubricant on my hands from the last demo. But this is what the dental dam is going to look like. So it looks like this. And then you can dab a few drops of lubricant on the side of the dental dam that's going to go against your partner to increase that pleasure for them. And then if you'd like, you can dab some flavored lubricant on the other side for the person who's going to be performing oral sex. You wouldn't want to put that flavored lubricant on the side that's going against somebody's genitals just because it could potentially cause an infection. But then you'll place the dental dam in place, like so. And you'll hold it in place during the act of oral sex. So you want to hold this in place the entire time. And then at the end of oral sex, when you and your partner are both done, you can remove the dental dam and be careful not to touch the side that was against your partner. So you'll pull it up like so and only touch the side that your mouth is on. And then you'll wrap that up and toss that in the trash as well. You want to use a brand new dental dam for every sex act. So you want to make sure that you're not reusing these. Some of them do come in little Ziploc packages, but that doesn't mean that you can pop it back in and seal it up. It's not good anymore. Once one's been used, you want to make sure that you toss it. Okay, so next we're going to talk about finger cups or gloves. So this would be a latex sheath that can be placed over a finger or hand during contact with the vulva, vagina, or anus. A lot of times we get questions about why somebody would need to cover their hand when engaging in a sex act. And that's just because our hands a lot of times will have little micro tears or cuts or a hangnail or anything like that that could be an entry point for somebody else's bodily fluids. So the purpose of using this is to keep bodily fluids from being passed between people in order to reduce our risk of HIV and other STIs. A lot of people have seen finger cups before in first aid kits or something like that. You can actually find them in the first aid section at a grocery store or drugstore. And they look like this. It looks like a tiny little finger condom. And you'll just place it on the tip of your finger and roll it down as far as it will go. So then that provides coverage for your finger. Another great option could be a latex or rubber glove that somebody can use, especially if they're going to be engaging in something like fisting, where more of your hand is going to be exposed to somebody else's genitals or bodily fluids. And that can give you a lot more coverage. So that's a great option for that. All right, so barrier 101, we're just going to go over some of the things that we talked about and using barriers effectively. So I mentioned before that you should always use a water-based lubricant with a condom or dental dam. We wouldn't want to use an oil-based lubricant because that will break down that condom or the dental dam. It'll break down the material, make it a lot less effective and a lot more likely to tear. You can tell if a lubricant is water-based because it will say it right on the front of the package. It'll say water-based lubricant. And if it doesn't, you can flip over and look at the back, and the first ingredient should be water. And that will let you know that it's water-based. It's okay to keep a condom or a dental dam in your back pocket for a short period of time. So if you know that you're going to your partner's house and you slip a condom or a dental dam in your back pocket and you take it out when the action's going to happen, that's fine, you're good to go. But over an extended period of time, you wouldn't want to keep putting that same condom in your back pocket every day or keeping it in your wallet or something similar because of friction and body heat that are going to break down that condom eventually. You also wouldn't want to use a condom or a dental dam after the expiration date because, again, that material is going to break down and make it a lot less effective. Next, you definitely wouldn't want to use 2 condoms during the same sex act. We've had lots of people asking if it's safer or better to double up on condoms, use 2 condoms at once, and that's definitely going to be a lot less effective. Again, it's going to cause that friction and make the condom so much more likely to tear. Next, we want to mention not using condoms between partners. So this means that you wouldn't want to reuse a condom. You'd never want to rinse one out and reuse it. You also, if you're having sex with multiple partners at the same time, would not want to use the same condom between partners. So also making sure you're using a brand new condom for each sex act. So you wouldn't want to switch from anal sex to vaginal or oral sex using the same condom. You'd want to get a brand new condom when switching. All right. When should I get tested? So we should get tested if you think that there's any chance you may have come in contact with any bodily fluids that contain STIs. Those are the fluids that Sarah mentioned earlier on in the webinar. So that would include blood, vaginal fluid, rectal fluid, semen, or breast milk. So if you've come in contact with any of those bodily fluids. And this can include needles, so tattoos, piercings, drug needles, because that can definitely make you potentially come in contact with somebody else's blood. Also, if you've engaged in any kind of sexual activity, especially with a new partner, and that would include oral, vaginal, and anal sex. And then once you have become sexually active, just getting tested once a year just to make sure that you're staying on top of that and knowing what your status is regularly. All right, so a couple of reminders. Make sure that you're using the appropriate barrier for every instance of vaginal, oral, and anal sex. And that would be a latex barrier, or if there's an allergy, potentially a polyurethane or polyisoprene barrier. Also, keep a supply of protective barriers on hand. That could be a little box in your bedside table or a shoebox in the closet, just making sure that you've got them on hand so they're there when you need them. Get used to protective barriers so they're natural and fun. So it feels normal to use them. It's not anything awkward or uncomfortable. If you're using them regularly, it'll just be part of the process. Next, talk to your partner about using protective barriers. You want to make sure that you're keeping open communication with your partner, seeing where they stand. Maybe there's a kind of barrier that they prefer using or one that you prefer using. So having that communication will definitely help make sure that you're on the same page. Like we mentioned before, not using condoms between partners. You want to make sure that you're using a brand new condom anytime you're coming in contact with somebody else's body. And using a new condom for each sex act. Like I mentioned before, you wouldn't want to switch from oral sex to anal sex to vaginal sex with the same condom because there's different bacteria in different parts of the body, and we want to make sure that they're staying where they need to be and not mixing. So next, refrain from using alcohol and or drugs because those can affect a person's judgment, motor skills, and ability to consent. Like I mentioned before, it's important that people are acquiring and giving consent for any kind of sexual act. But we also want to mention that consent is voluntary, enthusiastic, ongoing, and sober. If someone's under the influence, they might make a decision or might be influenced to make a decision that they might not otherwise make. Also, like we mentioned, motor skills. If somebody's under the influence, they may think they put a condom on, or they may put a condom on backwards, or the condom may have broken and they didn't realize it. So it's just important to make sure that we're refraining from using those drugs and alcohol. And then the last thing is to get tested and know your status. This is one of the safest ways that we can protect ourselves from STIs and HIV. Regularly going and getting tested to know where you stand. If someone does come in contact with an STI and they're getting tested regularly, then they can get that cured or treated as soon as possible to prevent the spread. Also, it's just really, really great to know what your status is in order to help keep yourself as healthy as possible. All right, so that brings us to the end of our webinar. Thank you. If you have any questions or feedback at all, our contact information is here. You can reach out to Sarah or myself via email, as well as our social media handles are there. Please feel free to follow us and connect with us. And yeah, thank you. Sarah, is there anything else that you want to add?
Thanks everybody for joining in. We really appreciate you taking our webinar. We hope you enjoyed it and found it helpful. Like Simone said, feel free to reach out if you have any questions, and we'll see you next time. Thanks.